Hi everyone! In this video we will be discussing the uses of the slit lamp and how to perform the TBUT. Firstly, what is a slit lamp? The slit lamp is a binocular viewing system which allows us to view the structures of the eye both illuminated and three-dimensionally. This is useful to observe the overall health of the eye. It is used to investigate the anterior and posterior structures of the eye that may not be seen naturally. In order to examine the eye clearly, a slit beam of bright light is focused onto the eye and viewed under a microscope. This gives the examiner a closer look at the different structures that make up the eye. It is a very useful tool in detecting, diagnosing, and managing eye diseases. Uses of a slit lamp. The slit lamp has many uses that can help the ophthalmologist diagnose the patients. These include intraocular pressure, or IOP, indirect ophthalmoscopy, fundus observation, gonioscopy, lid aversion assessment, and assessment of tear film quality. Parts of the slit lamp. There are several parts of the slit lamp that we need to familiarise ourselves with as ophthalmologists. On the patient's side we have headrest, forehead band, the headrest height marker, a chin rest, the chin rest height adjustment. On the examiner's side we have the lever for grey and red free filter, slit length, slit rotation, blue filter and fixation star control, stereo microscope with eyepieces, magnification lever, illumination unit and microscope angle scale, an illumination arm locking screw, slit width controls, joystick control lever. Setting up the slit lamp for the patient and the examiner. To set up for the patient, there are several steps that are undertaken. Before the patient's head comes in contact with either the chin or forehead rest, both should be sterilised with an alcohol wipe to maintain safe hygiene practices. The table height should be adjusted either up or down so that the patient can sit comfortably. The chin rest should also be adjusted for the patient as well. Your main aim is for a comfortable posture for the patient whilst maintaining their chin forward, their forehead forward, and also for their eyes to be aligned with the headrest height marker. Setting up for the examiner. Firstly, the eyepieces should be adjusted separately by turning the knurled ring to descale until the projected light slit from the lamp is seen in focus. It should be adjusted from positive to negative at low magnification to suit your refractive needs. Also, the pupillary distance should be changed to suit the examiner by rotating the microscope. What is a tear breakup time? The tear breakup time is a clinical test used to assess for evaporative dry eye diseases. It assesses the quality of the tear film. Indication of TBUT use. The main indication for use of the TBUT is if a patient has complaints of dry eyes. Contraindications of the TBUT are if a patient is allergic to fluorescein. Equipment for a tear breakup time. You will need a slit lamp set on the cobalt blue filter with wide beam and diffused illumination with a 10 times magnification. The illumination arm at 45 degrees. You will also need a fluorescein strip and local anesthetics or lubricants. Here is a demonstration of a slit lamp setup and the testing of a patient's tear breakup time. Firstly, the examiner turns on the slit lamp and switches its setting to full illumination. Then the examiner will place in the eyepieces that are of 10 times magnification. Then they will make sure that the lens changing lever is at 1 times magnification. The examiner then removes the guiding plate and inserts the focusing rod with the flat side facing the microscope. Each eyepiece will be adjusted separately to suit the examiner's refractive error. This will be apparent when the slit of light is in sharp focus. The IPD should also be adjusted to suit the examiner. Now the examiner adjusts the light to its fullest height and widest beam. The filter is changed to cobalt blue. The illumination arm is then unlocked and moved 45 degrees to the temporal side of the eye being tested. To ensure appropriate hygiene practice, the examiner must wipe the chin rest and forehead rest as well as the joystick. The examiner adjusts the table height for the patient's comfort, and the patient is then asked to place their chin upon the chin rest and their forehead firmly against the forehead rest. The height of the chin rest is adjusted so that the lateral canthus of the eye being examined is aligned with the marker on the slit lamp. Before the anaesthetic is administered, the examiner explains to the patient what they are performing. The examiner should first ensure that they are using the correct eye drops and that the eye drops have not exceeded their expiry date prior to their use. The examiner will maintain hygiene by removing the cap of the eye drops and holding it to avoid contamination. The patient is instructed to tilt their head back and look up while the examiner gently pulls down on the lower lid. One drop of local anaesthetic is then instilled to the lower fornix of the eye. The fluorescein strip is then opened, ensuring to avoid touching the orange tip. To ensure full fluorescence and patient comfort, the tip of the strip should be moistened with 1 or 2 drops of solution, either lubricants or local anaesthetic eye drops such as Alkane. Instruct the patient to look up while you gently pull down their lower lid. Apply using a gentle dab the moistened tip of the fluorescein strip to the bulbar conjunctiva. Ask the patient to blink several times to distribute the fluorescent. The TBUT should be performed in dim lighting conditions. The patient should be instructed to fixate on the examiner's ear directly in front of their eye. The beam should be positioned to eliminate the patient's whole cornea by moving the joystick forwards and backwards, whilst rotating to adjust the height until the image of the eye is in sharp focus. The patient is asked to blink once and instructed to keep eyes open while the tear film is being observed. The examiner then commences counting in seconds until the first appearance of dark spots occur on the cornea. This is recorded as the tear breakup time. Recording and interpretation. The tear breakup time is recorded as the number of seconds that elapse between the last blink and the appearance of the first dry spot in the tear film. This is how a TBUT is recorded. Normal measures. Anything above 10 seconds is considered normal. Between 5 to 10 seconds is considered marginally dry, and anything below 5 seconds has a high likelihood of dry eyes. And this is the conclusion of the video. Thank you for watching.